Hello, my name is Rumbi Bvunzawabaya from Tulia. Tulia is an organization that helps migrants to settle. I am a solicitor there and the founder of Tulia. So Tulia is a Swahili word, which means to settle. So we help migrants from the time they're planning to come to the UK right through to the time that they settle here and stay in the United Kingdom. Settle in terms of immigration status, but holistically in terms of family, in terms of social integration, in terms of cultural integration, until they become British citizens. So today I am doing this video, which is a special one on our YouTube channel. Please ensure that you subscribe to our channel so that you receive all notifications of new videos that we will be putting up. I am doing this video today talking about the red list. Now, we have had so many questions, so many inquiries from people asking about this red list. The majority of our clients are from Africa and Zimbabwe, Southern Africa, to be exact. And so some of the questions that we've had is, Zimbabwe has recently been added onto the red list. What does that mean for you? What does that mean if you're planning to come and stay in the United Kingdom, planning to come and work in the United Kingdom? So the code of practice for international recruitment, it says that some developing countries should not be targeted when actively recruiting health and care professionals. So active recruitment is the key word here. And the country list of countries is based on the World Health Organization Workforce Support and Safeguard List. And it is regularly updated. And the countries that are listed have a UHC service coverage index that is lower than 50 and a density of doctors, nurses, and midwives that is below the global median. So it's looking holistically at the whole world and seeing the number of doctors, nurses, midwives, and other health and social care professionals. The list doesn't prevent. So this is what's really, really important and what everyone needs to take heed of, to understand, and perhaps to pass on that message, because the message could be passed on incorrectly and stop somebody who was planning to migrate to the United Kingdom and feels that because they're on this red list, they're no longer eligible. So what the list doesn't prevent individual health and social care personnel from independently applying to health and social care employers for employment in the UK of their own accord and without being targeted by a third party, such as a recruitment agency or employer. So what this essentially means is that if you are looking for a job as a care assistant, as a nurse, as a doctor, you can apply independently by yourself to the employer. And this can be via their website, via adverts on LinkedIn, unsolicited advert. You can actually send emails to HR and you can apply directly. What cannot happen is that the companies cannot recruit through a third party. And this is something that is probably really beneficial for people because it cuts out the middleman. It cuts out exorbitant fees that have been charged by recruitment agents, and it makes it simple for people to directly go to employers. It cuts out, though, the other side to it, some of the incentives that were there, some of the packages that were there when employers are going to do recruitment in the country. So that is a problem. One thing that is really important is to realize that this guidance is not based on just your nationality, but your country of residence. So for example, if you are a nurse in Poland, but you are a Zimbabwean national, you can still be recruited via a third party. If you are a Zimbabwean nurse or doctor living in South Africa, it's not linked to your nationality, but your country of residence. So that is something, again, that is important. So there are so many countries who are on the red list. There's Afghanistan, Angola, Bangladesh, Burundi, Cameroon, Central Chad, Burkina Faso, Cote d'Ivoire. So many countries in Africa: Gambia, Gabon, Ghana, Madagascar, Malawi, Mali, Nigeria, Rwanda, Zimbabwe, Zambia, Uganda. So there's quite a lot of countries in Africa who are on this list. Zimbabwe has recently been added, and this is, you can still be recruited via a third party. If you are a Zimbabwean nurse or doctor living in South Africa, it's not linked to your nationality, but your country of residence. So that is something, again, that is important. So there are so many countries who are on the red list. There's Afghanistan, Angola, Bangladesh, Burundi, Cameroon, Central Chad, Burkina Faso, Cote d'Ivoire. So many countries in Africa: Gambia, Gabon, Ghana, Madagascar, Malawi, Mali, Nigeria, Rwanda, Zimbabwe, Zambia, Uganda. So there's quite a lot of countries in Africa who are on this list. Zimbabwe has recently been added, and this has caused quite a lot of alarm in the community. But the message that we're saying to you is, do not worry. Do not worry. There's still a shortage of health and social care employees. There's still a shortage of healthcare assistants. There's still a shortage of nurses in the UK, doctors, occupational health, physiotherapists, social workers. So you can still apply directly to the employers. There is a video that we've done before guiding people on how to find out who are the employers who are able to sponsor people from abroad. And on that list, you'll be able to find out which companies are still recruiting. You can contact them, go on their websites, and you can still make applications. So this video is just to update you, clarify, explain it in simple form, so that people do not feel that they are no longer able to come to the United Kingdom to work. The United Kingdom is open for business. It is open for labor, for people to come here and work. The doors have not been closed. It wasn't something that was too good to be true. No. In fact, other occupations have also been put onto the shortage occupation list, so there's even greater opportunities. And I will be doing more videos on some of the other occupations, some of the other ways that you are able to come to the United Kingdom. Please subscribe to our YouTube channel. Go and visit our website, which is www.tulia.org.uk, where you'll see all the services that we offer to the community. Also, please watch our frequently asked questions live videos on a Friday on Facebook. These will be on my personal page, Rumbi Bvunzawabaya, and also on the Tulia page as well on Facebook. And we will put these on our YouTube channel in case you missed them as well. Thank you, and please share this video so that we can get the correct information out to people.